In the second section, we will talk about different tonsillectomy procedure, and we will talk about different techniques used for the tonsillectomy, and especially we will discuss little in detail about dissection and snare method, which is very commonly performed for tonsillectomy. And then besides that, some other methods of tonsillectomy like intracapsular removal. Then we will talk about the laser method of removal, then cryosurgery method. Different electrocautery techniques can be used, but in detail we will talk about the dissection and snare method of tonsillectomy. So techniques of tonsillectomy. We have cold methods. In cold methods, we have dissection and snare method, which is most common method used for the tonsillectomy. So cold methods, snare and dissection and snare method. Then we have guillotine method, which is also a cold method. Intracapsular tonsillectomy with debrider. From the capsule, inside the capsule, tonsils are removed with the help of the debrider, debridement. Harmonic scalpel or ultrasound method of tonsillectomy. Plasma mediated ablation techniques. All these are different cold methods of tonsillectomy. Cryosurgery, cryo means cold, so the surgery done by the use of the cold or freezing temperature is the cryosurgery. Then we have some hot methods of tonsillectomy also. Electrocautery, that's the hot method. Laser tonsillectomy or tonsillotomy, in which we use carbon dioxide or KTP. Coblation tonsillectomy. So all these are the different methods of tonsillectomy. Can be cold method or the hot method. Most commonly used method is dissection, and the snare method, which is very commonly used and is one of the cold method. Then we have cryosurgery, plasma mediated ablation technique, intracapsular tonsillectomy, hormonal scalpel, ultrasound technique, then the hot methods also. Then we can use the radio frequency. So these are the four hot methods, and then we have 1, 2, 3, about 6 cold methods of tonsillectomy. So 6 cold methods, 4 hot methods. Among the cold method, the dissection and snare method is the most common method of tonsillectomy. Now dissection and the snare method. Boyle-Davis mouth gag is introduced and open. So Boyle-Davis, you can see this is the Boyle-Davis mouth gag. It is inserted and it opened, so the mouth remains open during the procedure. So Boyle-Davis mouth gag introduced and open to the extent so the view for the surgeon is clear and good. So this procedure can be easily performed. So mouth gag Boyle-Davis is introduced. Held in place by Dreffen's bipods or a string over a pulley. Dissection and snare method. Tonsil is grasped with tonsil holding forceps and pulled medially. Here you can see this is the forceps, tonsil holding forceps, just like a regular sponge forceps, which has a blunt rounded end. So you hold the tonsil, that's the tonsil, with the forceps and pull it medially. Medial is towards the midline, so you pull it towards the midline. Incision is made. So incision with the help of the scalpel is made in the mucous membrane, where it reflects from tonsil to interior pillar. From tonsil to interior pillar, the incision is made. May be extended along upper pole to mucous membrane between tonsil and posterior pillars, and then a blunt curved scissor used to dissect tonsil from the peritonsillar tissue and separate its upper pole. So this is the grasping of the tonsil with the forceps, pulled medially, then the incision is given, and then scissors is used to remove the tonsil from the peritonsillar tissue and separate its upper pole. So these are the pictures for the dissection and snare method. Tonsil held at its upper pole, traction applied downwards and medially. So here held at the upper pole, and then slowly traction pull is applied down and medially. Dissection continued with the tonsillar dissector or scissors until lower pole is reached. So tonsillectomy is not a very complicated surgical procedure. It's a simple procedure. Lot of tonsillectomies are performed. So Boyle-Davis gag is given, introduced, kept in place, and then the procedure is performed through that. The tonsil is held with the forceps, then the incision is given, and then it is pulled, and then slowly it is separated. So dissection continued with tonsillar dissector or scissors until the lower pole is reached. Wire loop of tonsillar snare is threaded over tonsil on its pedicle. Tighten pedicle, cut, and tonsil remove. So the snare, the wire loop of the snare is goes around the pedicle of the tonsil and slowly cut the pedicle and remove the tonsil. Gauze sponge is placed in the fossa that left behind after the removal of the tonsil. Pressure applied for a few minutes to stop the bleeding from that raw area from where the tonsil is removed. Bleeding point tied with silk, and procedure repeated on other sides. Usually both tonsils are removed. So on one side, after the tonsil is removed, pack is applied to stop the bleeding, and any bleeding point you suture it with the silk. Next is the Guillotine Method, which is another cold method. This is done for the tonsils which are mobile, so it's largely abandoned. Now this method is not very commonly used. Guillotine method, done only when we can do this when tonsils are mobile, they are moving, and tonsil bed has not been scarred by repeated infection. Here you can see these are mobile type of tonsils, and then when the scarring is not present as a result of repeated infection, because mobility is affected by the scarring as a result of repeated infection. If they are mobile, it means the infections are not present. Repeated infections do not occur, so they can be removed by the guillotine method. Electrocautery, you can see this is the electrocautery. We touch the area and it can cause burning. Unipolar and bipolar electrocautery reduces the blood loss, causes thermal injury to tissue. It decrease the loss of blood, but the disadvantage is it causes the thermal injury to the tissues. Laser tonsillectomy indicated in coagulation disorders. KTP 512 and carbon dioxide lasers are used. Former is preferred, so KTP 512 lasers are preferred for this laser tonsillectomy. Technique similar to dissection method of tonsillectomy. Reduce the size of the tonsil as a result of the laser. Indicated in patients who are unable to tolerate general anesthesia. We do not need general anesthesia for this procedure. So patients who are really sick, ill, cannot tolerate general anesthesia can go for laser tonsillectomy. Decreases the size of the tonsils. Laser ablation up to anterior pillars in stages repeated by applications. Intracapsular tonsillectomy with use of powered instrument debrider. Tonsil is removed. Capsule is preserved to reduce post-operative pain. So in this, the intracapsular tonsillectomy is done. The tonsil is removed, the capsule is preserved, and then this reduces the post-operative pain. Harmonic scalpel use ultrasound to cut and coagulate the tissue. That's harmonic scalpel. It uses the sound waves to cut and coagulate the tissue. Cold method causes less tissue damage. Less post-operative pain compared to electrocautery technique. Then we have plasma-mediated ablation technique. Protons are energized to break molecular bonds between the tissues. Cold method and does not cause thermal injury. Then we have coblation and tonsillectomy. That's the picture of coblation and tonsillectomy. Cryosurgical technique, again, tonsils is the application of cold frozen temperature to the tissue. Tonsil frozen by application of cryo probe, allowed to thaw. 2 applications, each of 3 to 4 minutes are done. Tonsillar tissue undergo necrosis. Death of the tissue occur as a result of that freezing temperature, which are performed twice for the 3 to 4 minute duration. Fall off, leaving a granulating surface. So tonsils fall off after the necrosis and it leaves the granulation tissue surface behind. So that concludes our section 2, in which we discuss different cold and hot methods of tonsillectomy, in which the dissection and smear method is most common method for performing tonsillectomy, and that is most commonly used. Thank you for watching sqadia.com.